our next guest, Greg Flynn, Chief of the West Bloomfield Fire Department. It is always a pleasure to have you with us on the Oakland County MegaCast.
Ronnie and Tyler, hello. It's been a little while, so
Yeah.
good to be speaking with you.
Usually we see you with the backdrop of the fire department behind you.
I know. I feel like that's such a letdown now. Whenever you're in my boring office, and I even have to close the blinds to try to help get the light right for the camera. So, it couldn't be more blah than what is behind me. So I apologize.
You know what? Tyler is a person with many talents. Maybe we can send him over there and paint your backdrop red.
There we go.
Tyler's like, yeah, no.
Yeah, that's what I need. Another task.
Chief, thanks for being with us. Give us some updates. Anything new going on over there with the fire department? I know we want to talk about suicide prevention, but before we jump into that, it's kind of a heavy topic. Anything new over there with the fire department that you want to share with us?
Well, I really just want to really compliment everyone on their attention to all the disease mitigation things that have gotten so much discussion since early March. And I really think that these best practices are really becoming sustainable behaviors. I love to hear people have to acknowledge that they're washing their hands often, something that we kind of took as an assumption that people were doing. Now that we're doing more of that. You're seeing hand sanitizer places. That social and physical distancing is taking place. So, great job. And how do we know that? We know that because when we look at our progress report and we look at those numbers, that we're keeping those numbers down. And it's not a report card. We're not done. These are just updates. And we're always vulnerable to something maybe going a direction we don't want it to. But right now, I think we're heading in a really good direction.
So, Chief, I know, like you said, that you get the progress reports, and one of the things before your staff members are sent out to any type of scene, they try to get information, the dispatchers try to get information about whether or not the person that they're going to treat could have possibly been exposed to COVID-19. What are those numbers looking like?
So those numbers remain low. We've seen the reports come through, so our reports are retrospective. So I look at yesterday's numbers, and we'll see numbers come through as zeros. And I think we've had one recently that maybe was as high as 6. So and remember, that is just, they screen for the potential of COVID. So really anybody suffering from respiratory distress, or if they had a fever, even unrelated to COVID, they're going to pop positive for our screening. And really all that's doing is giving our pre-hospital care providers, our firefighter paramedics, a little bit more of a heads up. They are critical thinkers. They are professionals. They're on the spot with this, and they're doing a great job. I couldn't compliment them enough.
Education is key, and we are all learning a lot about this virus and so much more as we continue in going into 6 months of this pandemic. Shifting focus right now, and one of the reasons we're having you on is to talk about a very heavy topic, but a very serious topic that needs to be discussed. Suicide is the 10th leading cause of death here in the U.S., and I know that the West Bloomfield Fire Department, this is a subject that is close to your heart, and your department is launching a suicide prevention campaign this month. Tell us a little bit about the program and why it means so much.
So our department did experience a death by suicide with one of our members, and that makes it, well, for years, clearly, as suicide and intentional death being that 10th leading cause of death. We've seen that as pre-hospital care providers over our careers. So very, aware of it, but clearly, like so many people have that personal interaction or that personal experience where a loved one, a family member, someone close to them has died by suicide. There is a stigma. There's a stigma even how we were to talk about it. If we were to talk about cardiac disease, I think the topic may not sound as heavy. And that's not a criticism of how you introduced it. That's a reflection of how we are as a society, as a community, that we struggle a bit discussing the pain and the circumstances surrounding somebody that's making that decision that they want to take their own life.
So tell us a little bit about your campaign. What are you guys going to be doing to bring awareness to this issue?
Well, one of the big things is just starting these community conversations. We know that while suicide hits the demographic of white males between the ages of 45 to 55 in there at high risk, we know that it goes across all races, all genders, all socioeconomic stratification, all of that. It goes into cities, it goes into rural communities. And we want to start the conversation. All of our firefighters are going to be wearing a shirt similar to this. On the back of the shirt, it has a suicide prevention message on the back. And what's unique about these shirts, and it's not just West Bloomfield. West Bloomfield is joining departments across the state of Michigan, and we have our state with the yellow suicide prevention awareness ribbon there. Over 3,000 shirts have gone out to local departments and fire department supporters to bring this awareness, to start the conversation, to let people know that it's okay to talk about it. It's okay that if you have depression and you're seeing somebody and talking about that and processing that, that's okay. No different than monitoring your blood pressure or your sugar. We know that the body, both emotionally and physically, those two things need to work well together. And that's okay. I've talked to someone, and I don't have a problem sharing that, there are things in the job that get stressful, and it's nice to go talk to somebody that will just hear you out and help you process and straighten out some of those pathways and get you thinking clearly again. And we shouldn't have a stigma about that, and it should be okay to say, hey, I went and talked to somebody, and I feel better, and they're helping me.
Chief Greg Flynn with us from the West Bloomfield Fire Department on the Oakland County MegaCast today. The fire department, also our Facebook partner, and we thank all of you watching on their Facebook page for joining us on today's program. So, Chief Flynn, you talk about bringing awareness to the issue of suicide and getting people more involved in spreading the word about prevention, about talking to someone if they're in a tough situation with their mental health. What resources is the fire department pointing people towards as they are continuing on these educational efforts for those that maybe are in a tough spot, or those that see somebody that they care about, someone that they know that is going through a tough time in their life?
Tyler, often I view the role of the fire department in some situations, while clearly when it comes to fire suppression and emergency medical care, we're that primary support. In other areas, we help to fill gaps. So we fill gaps, or we create that bridge to the resource. So if we're able to get somebody to the hospital where they can talk to a social worker and then create a relationship with a therapist, then that'll work. If through our Facebook messaging, we're putting things out where if somebody needed the crisis suicide hotline, then that number is provided, and I'm sure something that you guys will be able to share on your page as well. And it's important to keep in mind too that part of the message that we're trying to get across is early intervention. We know that death by suicide is kind of this final outcome, if you will, but before that there were many opportunities that there could have been some type of there may have been opportunities for some type of intervention to take place. So if it's early onset depression or anxiety, or these other, and I'm not a clinician, right? That is not my background, but I'm aware of it, and I'm comfortable having a conversation about it, just like I'm not an expert in hypertension and I'm not an expert in diabetes, but I know enough about it to know that I need to go see someone that's an expert to help me get on that correct path so I can live a long and healthy and, very enjoyable life.
Chief Flynn with us, the West Bloomfield Fire Department on the Oakland County MegaCast. The Suicide Prevention Lifeline, 1-800-273-8255, 273-8255 for anyone who is out there who may be thinking that they need to just have a conversation with someone. And how did your team handle it post-suicide of one of your members? Because guilt is such a heavy thing. And so what areas did you have to change and have to address to try to help them through surviving this as well?
Yeah, that's a difficult question. So much of the processing that takes place as all of us go through that relationship with that loved one, that individual, that close friend of ours, has an influence with, that individual side of it for you and how you're going to process. So as an employer, that is a very difficult thing. I struggle from time to time as the leader of an organization to try to connect individually with each person and meet them right where their needs are. A nearly 100-person department, that's challenging. I'm not trying to say I'm shirking that responsibility or I don't want to do it. I'm just underscoring the need, or that saying, it takes a village. We had to come together. We leaned on our chaplain, Tim Holzerland, to really come in and give us some coaching in how to interact with people. We followed up after the fact, days, weeks, months, and even to this day, we still talk about Lieutenant Hiltner and celebrate who he was and the service that he provided to our communities served by the WBFD. And I think that's all part of it. I don't think we're done. I think, I know, speaking for myself, I'm not. I still have reflect back on that relationship, and I definitely look forward to what steps can I take to help prevent that. What could I have done? Could our whole team here have done to do a better job? But we need to be careful that we don't dwell on that too much. That, that guilt that you spoke of, Ronnie, we don't want that to overwhelm us and give us kind of this analysis paralysis where we're focusing so much time back there that we're not looking forward and trying to apply some of those simple things that we may have been able to change and look for signs and symptoms like not resting well, unusual sleep patterns, giving things away, kind of a change in interaction with people, things that you would commonly see on risk factors or signs of a person that may be thinking of harming themselves.
Yeah, when you can't look back, one of the things is to learn from previous experiences. And I think there is such, people don't want to talk about that, even more so in your profession or law enforcement or amongst healthcare workers right now, where there is an increase of suicide following COVID and some of the things that some of the first responders have had to experience. So removing that stigmatism that comes with even talking about mental health is such an important part of this. And to your members and the people of the community, it's a great service that you're providing, and just saying it's okay to talk about it.
And that really is the first step. Often there's a good video on YouTube that you can look up. It's called The Black Dog, and it talks about depression and this kind of life of having this black dog that follows you. And it really is a powerful video to watch, and I would encourage viewers to look that up and just take a moment when you have some time to yourself to watch it and really reflect on the video itself and what it's speaking to you about, and saying, get the help, because there's so much out there to enjoy. Now, that is easy for me to say, and I am oversimplifying the complexity of behavioral and emotional health issues. You've had some great professionals on this show that have the background and could go more into the science. Our mission, what we're hoping to do over this month of September, is just to get people to talk about it, to rephrase things. Instead of saying somebody committed suicide, that someone died by suicide, we put that committed next to it, like it's this, like this crime, if you will. Like you don't commit a heart attack, you don't commit a stroke, but those are ways of dying too. And death by suicide is another way. In fact, as we said, it's the 10th leading cause in the United States. So how we talk about it, how we phrase it, how we say to others that have lost, how we engage with them that have lost a loved one to death by suicide, that's difficult. And, I can't say exactly what that looks like. What I know is I just want to share with someone that I care about them, and that we celebrate that person that they lost, because clearly they were hurting. You think about it, Tyler and Ronnie, every single day, we focus on feeding ourselves to stay alive and to breathe and do other things to stay alive. To go that direction of ending that life, that's a huge hurdle for someone to get over, and it's going to take that's a lot of pain and things that they're working through to make that decision. And they get often characterized as weak, and I think that's a mischaracterization of those individuals that have arrived at that is their final decision.
Has your department seen a rise in people that have either committed or who have either died by suicide? See, I just caught myself right there. So it's an important conversation that we're having right now, but that have attempted as well during this time.
So our medics will code their impression of what was happening. It's important to realize that we're not therapists, so the important diagnosis is probably a more important diagnosis as we talk about this as a disease, as a illness, or as a way of dying, is that clinical follow-up that's going to take place at the hospital to really understand why that person arrived at that decision. Some things are accidental in the true sense. There can be an accidental overdose where someone just inadvertently took too much of a medication, and that is different than a death by suicide, an intentional ending of your life. So I don't have a number here to say, here's what it is in West Bloomfield, although I'm sure we could dig around and probably find things that start to narrow it down by the county. I'm very confident that Oakland County Health would have some of those numbers. But we know it's prevalent because it is the 10th leading cause of death in the United States.
Healing starts with conversation, and we appreciate and thank you for taking on this tough topic there in the West Bloomfield Fire Department.
Well, and often I get to be the face of the department, but I want to share with you that it truly is the men and the women that are out there in the stations right now, every day, 24 hours a day, 7 days a week, that you don't get to see and you don't necessarily get to talk to. They're the ones who really are doing that. I'm, again, in this boring office with lots of paper and stuff around me. The people that are really making that impact, when you call 911, the paramedic that walks through that door, the paramedic that's holding your hand on the way to the hospital and saying, I care about you, they're the real heroes out there. And I want to make sure that out of all these interviews, that's where the spotlight is, because they are the ones that really make a difference to the residents out there. They're the ones that are going to be there at the end of that 911 call and coming through that door.
West Bloomfield Fire Chief Greg Flynn, thank you for being with us on the Oakland County MegaCast.